I am a god. Everybody says, who does he think he is? I just told you who I thought I was.
Hello everybody, and welcome back to my channel, Mental Health with Melissa. I'm Melissa. I'm a licensed clinical therapist. Today I am going to be talking about bipolar disorder and as it relates to Kanye West and his now almost ex-wife, Kim Kardashian. Before we get started, please don't forget to hit that like and subscribe button for more content like this, because it really helps me get information out there to our communities about mental health and also to those that are interested in the mental health professions. Okay, well, let's go ahead and get right into it. Before I get started giving my thoughts and commentary on Kanye West and his mental illness, I just want to add a disclaimer that I obviously don't know Kanye West personally. I don't treat him. I don't know the ins and outs of his mental illness or if he's been diagnosed with any other co-occurring disorders. So I think that's just important to keep in mind, because I am not his doctor. I am not his therapist, his psychologist. He is just somebody that happens to be in the limelight, and I think he's actually using his platform in a good manner because he's able to bring this conversation about mental illness to the forefront.
In your brain, do you know?
I wouldn't be able to explain that as much, just because I'm not a doctor. I can just tell you what I'm feeling at the time. And I feel a heightened connection with the universe when I'm ramping up. It is a health issue. This is like a sprained brain, like having a sprained ankle. And if someone has a sprained ankle, you're not gonna push on him more.
Right.
With us, once our brain gets to a point of spraining, people do everything to make it worse.
So I want to start off by saying that there are two main types of bipolar. There is bipolar 1 disorder and bipolar 2 disorder. So I'm going to start off by telling you what bipolar 1 disorder is. Bipolar 1 disorder really, it compromises of a person having manic episodes and also episodes of depression. So you may have heard of people describing bipolar as experiencing highs and lows. So that certainly is a very shortened way to describe it. So with bipolar 1, you can expect somebody to experience the manic episode, which is the high episode. So a manic episode is really more than just feeling extremely elated. It's when a person has a lot of energy, extreme restlessness, trouble concentrating, excessive feelings of euphoria, risky behaviors, and poor sleep. Another sort of characteristic of mania, especially when it comes to bipolar, you can think of somebody that is shopping uncontrollably and also may be gambling or spending a lot of money, anything of that nature. Now, bipolar 2 disorder involves a major depressive episode lasting at least 2 weeks and at least one hypomanic episode. So really the difference between bipolar 1 and bipolar 2 is that in bipolar 1 disorder, a person may experience a full manic episode, while a person with bipolar 2 will experience only a hypomanic episode that's less severe than a full manic episode. And a person with bipolar 1 disorder may or may not experience a major depressive episode, while a person with bipolar 2 will experience a major depressive episode. So along with mania, another symptom that may be an extension off of that is experiencing psychosis or delusions of grandeur. And this is important to kind of keep in mind as we relate it to Kanye, because we see that in his discussion of his mental illness that he really does suffer from really a lot of these symptoms that we've kind of talked about. And that's why I wanted to show some of these clips, because these clips and these videos of him are him really at the height of his mental illness. You can see that he's really having a challenging time in expressing himself and may come off as kind of disrespectful, but really, again, he is just dealing with the repercussions of his mental illness. So, bipolar is not a diagnosis that can be completely cured. I mean, if you are able to get specific treatment for it, go on a specific medication regimen, and have therapeutic interventions with the support of your family and loved ones, then it can be managed. But unfortunately, it's not something that just goes away. Just like any medical diagnoses, such as a chronic medical condition like diabetes, for example, that won't just go away. It has to be carefully managed by the person that is diagnosed with it, with the help of treating providers and also loved ones. So the other thing to kind of keep in mind is that bipolar can be triggered by drug use, alcohol, or really stress. And so that's why it's so important, like I mentioned, to really manage it. And so you can imagine that somebody that is not on a proper medication regimen, or that is not managing their stress or getting any type of intervention from a clinical provider, is going to have a hard time managing their symptoms of mania, depression, or psychosis, because again, these are all symptoms of bipolar. And so in the case of Kanye, again, I don't know if he's receiving any sort of interventions or medications, but we do see that he's struggling. And if we're bringing Kim into it and they're married, it makes things very challenging to be able to be with your loved one if they're not going to be compliant, and their behaviors are going to be, again, very manic, and they're going to be experiencing psychosis. So we can understand that this is a lot more challenging than one may think. As we see here, this is a very popular scene from when Kanye went on a rant about wanting to abort his first child, but his partner Kim had still wanted to go on with having the baby. Now, this seems to be a manic episode from the way that he presents and appears. Again, I can't assess him because he's not my patient, but one can take a look at him and see that this person's really struggling, and he has admitted that he's been diagnosed with bipolar. So the loved ones of somebody that is managing a mental illness to this degree is going to have a hard time too, I assume. And so seeing all of the media about how Kim is not handling this is kind of disheartening, because she's probably going through it as well. So again, recommendations for bipolar are to reach out to a doctor and talk about interventions and medication. And if you're a loved one of somebody that's suffering, please support them. As always, don't forget to subscribe and like to my channel. Managing Mental Health Matters.